Hi, I'm Arthur Evans. I'm the Chief Executive Officer of the American Psychological Association. I trained as a psychologist and I have worked most of my career in public service in the state of Connecticut and Philadelphia prior to coming to the APA.
Hey everybody, I'm Joe Kennedy. I'm a congressman from Massachusetts, and mental and behavioral health has been a major area of focus of mine and an overhaul, necessary legislative overhaul to make sure that everybody gets access to the healthcare and mental and behavioral health care that they need when we need it. And the lack thereof, I think we see cascade through so many other aspects and sectors of our society. And I think important for this conversation, I'm a huge fan of Dr. Evans. So looking forward to the conversation and always learn an awful lot from his perspective. And I think there's an awful lot to learn, particularly in this moment. So Doctor, I'd love to get your thoughts first on kind of as we come out of this pandemic and with the calls for racial justice that we are seeing in this country, how from a practitioner standpoint and from a public health standpoint, how do you even start to kind of evaluate what needs to be done and what our country needs?
Well, first of all, I think we have to recognize what a significant psychological and mental health event this pandemic is. And it's not just the pandemic, but it's this cascading set of events that have happened in the aftermath of the pandemic. It was first the pandemic, which was unprecedented in terms of its mental health impact. And then it was the economic meltdown that we are starting to see that also has a lot of mental health consequences. And then the racial tensions that we've seen also have the stress associated with it. In fact, the American Psychological Association just did a survey recently, and we found that the stress levels in the country right now are the highest that they've ever been since we've been doing the survey, which is over a decade. And then for African Americans in particular, the stress levels, which are typically higher, are even higher than they normally are. So relatively, they are still much higher than the general population. So, as much as we have to focus on managing the pandemic and the economic issues and the racial issues, we have to be thinking about the mental health issues, because what we know is that the kinds of stressors that people are experiencing will not only cause mental health challenges, but they will cause physical health challenges as well. So it's really important for us to have this discussion and to look at how our public policy can help in this area.
And so we've had a couple of these discussions before, Doctor, but help me try to, one of the focuses of my efforts down in Washington on this has been on the lack of access to mental behavioral health care, right? So 55% of the counties in our country do not have a single practicing psychiatrist, psychologist, or social worker. So nothing, right? There's going to be counties, urban Philadelphia, that do have those, have a supply of practitioners, but the demand for them so outweighs the supply that, particularly for folks that are on Medicaid, the wait lists are going, and the wait times in order to be seen are going to be extraordinary. I assume that that's going to compound dramatically as we work our way out of this crisis, no?
I think it absolutely will. I have two minds about this. On the one hand, we know from a lot of research and experience that the kinds of events that we're experiencing right now are likely to cause significant mental health challenges, and some people are anecdotally already reporting that. On the other hand, in the same way that we tried to bend the virus curve, we ought to be thinking about how do we bend the mental health curve, because it isn't inevitable that all of us are going to have mental health challenges, and we need to be thinking about and applying the research that we have to ensure that that doesn't happen. I think that there's a little silver lining here in that when the country was on lockdown, one of the things that happened is that policymakers very quickly allowed telehealth, the ability for clinicians to see people from their homes and continue treating people. And we've made more progress on telehealth literally in probably about 2 or 3 weeks in the immediate aftermath than we probably would have made in 2 decades had we gone the normal route. And so right now we have infrastructure all over the country that allows us to reach people in hard to reach places, communities that we've never reached before, The American Psychological Association also advocated for, and we were successful, all of us who were advocating for this, for phone telehealth as well, which was something that was a real barrier for people in rural communities that don't have the bandwidth. So we now have that infrastructure, and we need to make sure that that infrastructure stays and that those policies stay in place. But I think the bigger challenge for us right now is that we have to be thinking much more in a prevention mode. Our healthcare system is set up on diagnosis. And in the mental health world, we wait until people have a diagnosis, and not only a diagnosis, but typically in crisis before we provide any kind of services or intervention. And if there's anything that we know from this pandemic, it is that there are many people that are at greater risk, and now is the time for us to be intervening. So we really have to think about the policy shift from just only providing services and beds and treatment to thinking much more upstream about how do we prevent, how do we mitigate, how do we reduce that curve.
And I got a couple other thoughts on this one too, though, because what we've seen in part as various communities that have been hard hit, Massachusetts, New York, and other, some at this point anyway, major urban centers have been hit so hard. As we start to reopen, that stress actually gets put oftentimes on those essential workers that are oftentimes Black and brown, immigrant, low income, that bore the disproportionate brunt of COVID, but then are now going to be wrestling with some of the stress issues or mental behavioral health issues that we're also now trying to say, hey, don't have to choose between, as we're saying, don't choose between your health vis-a-vis COVID and your financial solvency and stability. Now we're going to be asking them to do the same thing with regards to mental health. So how, I'm not so sure that, at least in the reopening plans that I've seen, there's been a whole lot of appreciation for the mental health strain on that part of our reopening. How, and telehealth obviously plays a role in that, but part of that is just a willingness for people to reach out and try to gain access to the help that they need. How should we be thinking about that aspect of this?
Well, we really ought to think about particularly people who are in a position where they're deemed essential, about the mental health aspects. I did a webinar recently, and I was talking to CEOs, and everyone on the panel, they were people who are building specialists and engineers, and they were focused on how do you prepare the buildings for people to come back in safely. And they're talking about, viral transmission, all these things. And the point that I made is that we have to think about how do we prepare the people as much as we think about how do we prepare the physical environment. Because if we don't do that, people are not going to be successful. And not only are you going to have issues with the productivity of folks, but you also run the risk of people having the kind of mental health sequelae or issues related to the stress of coming back. So the first thing is that we have to understand that all of us are in this, and that there are things that employers can do to help mitigate the stress. For example, one of the things I said to the CEOs is that one of the things we know from psychological research, for example, is that the more control that you give people, it's one of the strategies for reducing stress. And so if you have a plan to return to your building, think about the ways that you can allow your workers to have more control over that process, have them be a part of the decision-making, as one example. And I think one of the things that we have to do is to move from this idea that mental health is something that only mental health practitioners over here can deal with, but to more of a public health framework that says there are things that we know from research that all of us should be using and implementing, in whether we are parents or whether we are employers or whether we are business people in the community, that can help mitigate against the stressors that people are experiencing, and lessen the likelihood that people are going to run into problems.
And Doctor, much of this focus, and even our conversation beforehand, one of them anyway, was on the mental health impact of COVID. We've also seen over the course of the past several weeks these searing episodes on video. George Floyd, obviously, but another murder that we've seen in Atlanta as well, that have rattled the nation and have had, at least in my conversations with peers, colleagues, members of our community, that have shaken people obviously to the core. And how do you start to wrestle with the impact of the awakening from some of the massive racial inequities that still exist to this day, that are now caught on videotape, so you can't ignore and you can't look away, but coming out of also a pandemic, there's an awful lot that needs to be addressed here. And so how are you thinking about the impact of these episodes on that have just dominated conversation, and rightfully so?
Yeah. Well, the psychological impact of all of these things and the confluence of all these things is pretty significant. And as I mentioned, our reporting, our surveys showing just how high the stress levels are. I think that the first thing that we have to do is to create forums where we can talk about these issues, particularly the racial issues. And when we, in the immediate aftermath of George Floyd's death, I just heard so many people anecdotally from the African-American community, for example, talk about, I'm just tired. People have this sense of, what is it going to take to deal with these issues? Something that many people may not recognize is that for African-Americans, for example, they are under constant stress. There's a certain level of processing that people have to do just to be in the world. I think it's very similar to what a woman who is walking into an environment that is all male environment. There's a level of processing that you have to do that everyone else in the environment doesn't have to do, but you have to do because of your position within that social context. Well, that's something that African Americans have to do all of the time. And there's a cost to that. It's like running a cell phone with all of your apps open. You start to get that degradation in performance. And then in the midst of that, you have a pandemic. In the midst of that, you find out that there's disproportionality, that your community is being greater, is having a greater impact. In the midst of that, you have this economic crisis. In the midst of that, you find out that, again, your community is being disproportionately impacted. And then you find that in the midst of all of that, that these racial tensions and issues that have been longstanding are still having the impact. And so I think it's really important for people just to understand the impact of that and the need for people just to be able to express and to talk about that. One of the things that I'm very hopeful for as an African American is just how many allies and people, not only in the United States, but around the world, are seeing this as a critical issue and something that we have to deal with. That in and of itself can have a positive impact on people's mental health. Knowing that I'm not in this by myself, but there are allies and people from other communities that are in the fight to create more social justice. So I think that having these conversations, people standing up and saying, I'm willing to do something. People don't always have to know what to do, but just expressing that can make a huge difference. And then ultimately we can get to what are the things that we're going to do to address this. So I'm hopeful. I know how significant this is and how serious it is, but I'm also hopeful by many of the signs that we're seeing in terms of people's willingness to take on this issue that has affected so many people.
I know time's running short, Doctor, and I think from a Washington perspective, there's this movement, and rightfully so, to address police brutality and the disparate impact we're seeing in policing, which needs to happen. There's also, I hope, a growing acknowledgement that part of that comes from us asking police to do an awful lot. That the largest providers of mental health in our country are jails in LA and Chicago. That in Massachusetts, if you ask our sheriffs who run our jails, 89 to 90% of incarcerated individuals are suffering from substance use disorder, mental illness, or both. Mm-hmm. This country criminalizes mental illness. Mm-hmm. right? And we basically say, hey, no one else is set up to care for folks, the 20% of Americans that will deal with some sort of mental behavioral issue over the course of their lifetime. No other structure is set to deal with them. So one, we're going to let police deal with it, but then when police deal with it, it leads to eventually incarceration if left unaddressed. And now we're just locking up people that are sick. And many circumstances, the right person to respond to some of these issues isn't necessarily a police officer, it's a social worker. It's a trained mental behavioral health professional. And this has got to be part of these reform efforts to recognize that we see the consequences of the lack of understanding, investment, structures, practitioners, experts, cascade in so many other facets of our society, from early intervention in schools to, again, our criminal justice system to our healthcare system. And hopefully we learn this lesson now so we don't have to keep repeating it. But it is always a thrill for me to be with you. And
absolutely. So I appreciate you. And you know what, I just have so much respect and regard for you. You've done so much for our field. Your staff, in fact, your whole family has been such great champions. So I just appreciate and am honored anytime I get a chance to talk with you. So, you know, stay in the fight. We got a lot of things that we have to take on as a country. And I personally feel good, even though you're not my congressman, I still feel like you're fighting for the issues that I care about, and I appreciate you.
Doctor, grateful.
Okay, thank you.